What are urodynamic studies, and how do they help? Imagine trying to figure out why you feel constant pressure, or why urination feels difficult or incomplete. Urodynamic studies are a set of tests that help doctors understand exactly how your lower urinary tract is functioning. They measure how well your bladder, urethra, and sphincters store and releases urine. These tests look at bladder pressure, how fast urine flows, how much the bladder can hold muscle activity, and how much urine remains after you go. They are especially helpful if you're experiencing symptoms like trouble urinating, frequent urination, or incontinence. In relation to prostate health, urodynamic studies are very useful. When the prostate enlarges, it can block urine flow, leading to symptoms like a weak stream, hesitancy, or feeling like the bladder isn't emptying fully. These tests help doctors see how much the prostate is obstructing the flow and whether the bladder muscles are working properly. They can tell if the symptoms are mainly caused by prostate enlargement or if there is a bladder problem that needs different treatment. One key part of urodynamic testing is uroflowmetry. This test measures how quickly and how much urine you pass. If the flow is slow, it might suggest an obstruction like an enlarged prostate. Another important test is measuring residual urine, which shows how much urine remains in your bladder after you urinate. A high residual volume can mean your bladder isn't emptying completely, which is common with prostate issues. Cystometry is another component. It involves filling the bladder with a small amount of fluid to see how it responds. This helps assess bladder capacity and whether the bladder is overactive or stiff. The pressure flow study measures the pressure in your bladder during urination, helping determine if the bladder is contracting properly or if there is an outlet obstruction. Electromyography checks the nerve and muscle function in your pelvic area, especially if nerve damage is suspected. For men with prostate cancer, urodynamic studies can be done before and after treatments like surgery to see how the bladder is functioning. They can help evaluate if the bladder is adapting well or if there are issues like incontinence or decreased compliance after treatment. Doctors use these tests to get a clear picture of what is causing urinary symptoms. They can distinguish between problems caused by prostate enlargement and those caused by bladder muscle weakness or nerve issues. This helps guide treatment choices, whether that means medication, surgery, or other interventions. Urodynamic studies can also predict how well treatments like prostate surgery might work and help monitor bladder health over time. Overall, these tests give detailed, objective information about how your urinary system is functioning, information that physical exams or imaging alone might not provide. They are especially helpful when symptoms are complex or not responding to initial treatments. If you are experiencing urinary difficulties related to prostate health, talking to a healthcare professional about whether urodynamic testing might be right for you is a good step. Remember, every person is different, and your doctor can help tailor the best approach based on your individual needs.